Hey, what's going on? This is Ryan Williams at Cornerstone Insurance Solutions, and I just want to go over the two main options that you have as someone who qualifies for Medicare. So the two options that you have, the two broad options, is number one, you have Original Medicare. That's where you have your red, white, and blue card that contains your Part A insurance. That's your inpatient, anything that deals with an inpatient in the hospital stay, that's going to be under your Part A, and anything outpatient is going to be your Part B, your medical insurance. So that's what is usually located on your red, white, and blue card under Original Medicare. Also, under Original Medicare, you have the opportunity to get a supplemental insurance policy. Now, what that is the supplemental policies cover the other 20%, and they also have some other benefits, but essentially it covers the 20% that Medicare does not cover. Medicare covers the 80% of your health insurance costs, and the supplemental covers the other 20%. If you don't have that supplemental policy under Original Medicare, the sky is the limit in terms of your potential health care costs. Because you are on the hook for the other 20%. So if you rack up $100,000 worth of bills, you could be on the hook for the other 20% of those bills, which would be $20,000. So the supplemental policy is something that is really necessary in terms of having Original Medicare, just because the cost per month is nothing compared to what you could pay out of pocket. And then the Part D, which is your prescription drug plan. So you have your Part A, your Part B on your red, white, and blue card. You have your supplemental policy that covers the other 20%. And then you can pick up a prescription drug policy, and that allows you to get your prescriptions at a reduced cost, a lot of times a lower copay, and you just pay a monthly premium to have that Part D prescription drug coverage. Now that essentially covers the Original Medicare side of it. Now your other option, other than having that, is something called a Medicare Advantage plan. Now the Medicare Advantage plan, once you enroll into one of those plans, it lumps your Part A, your Part B, and your Part D, your prescription drug coverage. It lumps all of that into one plan. One of the things, usually it's much cheaper, and sometimes there's no monthly cost at all to have that type of policy. But once you have that type of plan, you don't pay so much for the monthly premiums. A lot of times you pay on the back end. You could pay a lot more money when you actually go to use those services, sometimes up to $5,000, $6,000. And so a majority of our clients have Original Medicare just because it works out for them financially. They have the better coverage, and also they have a much wider network of doctors. Under Original Medicare, you can go see any doctor that accepts Medicare. However, under the Medicare Advantage plans, even though they're a little bit cheaper on the front end, you could pay a lot more on the back end, and also you can't go see any doctor that you want. You have to go to the doctors that are in with their specific network. And so sometimes a lot of people can be deterred by that, not only the cost aspect, but also the fact that they can't keep their doctor, and they may have to go to a doctor that they don't want to go to. So those are your two main options. Again, a majority of our clients are on Original Medicare. They have the supplemental and the standalone prescription drug plan. However, we do have some clients that a Medicare Advantage plan does work out for, and it's within their best interest to get the Medicare Advantage plan. So everyone is different. Everyone's situation is different in terms of finances, what doctors they need, and what coverage is better. But essentially, if you need help with that, we'd be happy to go over that with you and make sure that you are on the best type of plan, regardless of whether you're turning 65 or maybe you've been locked into a plan for the past couple years. Each year we review your Medicare insurance policies that you have, and we make sure that you're not overpaying and that you have the best coverage possible. Again, my name is Ryan Williams. If we can be of any service to you, we'd be happy to help. I'm Ryan Williams with Cornerstone Insurance Solutions. Hope you have a great day. Take care.